If she comes to me with a complaint of pelvic pain, we do a complete history from the standpoint of how long have you had this? What type of pain is it? How often do you have it? So we go into the details and the specifics of what the pain is. And you have to remember that every single patient has a different type of pain. So one patient's pain can be quite the flip side of another patient's pain. But it's important for the patient to actually discuss this with her physician verbally, to let the physician know how miserable they are on a scale of misery, 0 to 100. It's important to make sure that the physician that they're working with, they're happy with from the standpoint of his responsiveness. Is he responsive to my needs, and does he understand, and does he seem to have a ability to be compassionate in regard to the terrible pain that the patient has had? You must remember that these patients often are what I call my silent sufferers. They suffer on a daily basis, a weekly basis, a monthly basis, an annual basis. They're constantly bombarded with pain, and yet they do it silently, and they try to go about their work and take care of what they need to do, and then come home at night and collapse. So I call them my soldiers of silent suffering, because they really do end up with a large pack on their back from the standpoint of the amount of pain that they have, and the frustration that they've had to find at least some relief from the pain.